Good morning and welcome to the Healthy Seniors webinar series brought to you by the Department of Health and the World Health Organization in cooperation with our partners, which we will introduce as the speakers come aboard. So in the Philippines, the first week of October is
Good morning and
Filipino
welcome to the Healthy
Elderly Week.
Seniors webinar series
Let me
brought
just,
to you by the
okay. In the Philippines, the first week of October is Filipino Elderly Week. The WHO Philippines Country Office, together with the DOH, the Philippine College of Geriatric Medicine, the UP National Institutes of Health, Institute of Aging, is now hosting a 3-day webinar series together with our guest speakers, which you will get to hear from as we introduce them one by one during their speaking roles. We'd like to start this webinar series first with a welcome message from the Department of Health. On behalf of Undersecretary Mirna Kabatahe of the Public Health and Services team, I would like to call on Dr. Faith Alberto, Director 3 of the Disease Prevention and Control Bureau, straight from the DOH Central Office. Director Faith, please come aboard and welcome.
Thank you, Dr. Albert. Good morning, everyone. Today marks the start of the 3-day webinar series entitled A Day in the Life of Senior Citizens and Those Who Care for Them During COVID-19. And it is my great pleasure to welcome everyone gathered here. At present, our Filipino older persons are faced with numerous health issues and problems. Many of these can be prevented or delayed by engaging in healthy behaviors and practicing minimum health protocols. Indeed, even in very advanced years, physical activity and good nutrition can have powerful benefits for health and well-being. Other health problems can be effectively managed, particularly if they are detected early enough. Even for people experiencing declines in capacity, supportive environments can help foster healthy aging. With the Universal Healthcare Act, we wish to build on what the DOH and other agencies are already doing and provide the platform for interlinking health products and services, health facilities, and human resources for health to expand access to comprehensive care at all life stages, especially for our senior citizens. Moreover, to mitigate the impact of this pandemic on the delivery of health services, the Department of Health issued interim guidelines on the continuous provision of essential health services for senior citizens and amid COVID-19 pandemic. The growing aging Filipino population demands a comprehensive public health response, and it is our goal to improve the health status of our elderly and enable them to fully enjoy their right to health. Achieving this goal entails a more holistic and inclusive approach. Through this webinar, we can look at the practical pointers on how to care and show support to the elderly in order to maintain their well-being. Furthermore, we want to inform and educate all people, equip them with all the resources through this webinar series with the hope of a towards our vision of a society with healthy and productive senior citizens who continue to contribute to the betterment of this society. Once again, thank you and good morning and welcome.
Thank you po, Director Faith Alberto from the Disease Prevention and Control Bureau, delivering the welcome message on behalf of Undersecretary Mirna C. Cabotaje of the Public Health Services team. I'd also like to mention that part of the organizing team is Dr. Minerva Vinluan, who is the program manager for this particular program on healthy aging. And with that, I just like to welcome our, would you know that, 500. The Zoom room is full, 500. 500 participants are in the Zoom room. Yes, Doc Faith. Doc Faith, nagulat siya. And there are actually 46 more in YouTube and the number is going up. Just to give our participants an idea where everyone is coming from, yeah, I'm seeing from Cavite, from Pagadian City, from Zamboanga. Oh, we have someone from Saudi Arabia. Is it good morning over there? Or yes, we're going international. Valenzuela City, Batangas State University. Yes, and De La Salle Medical and Health Sciences Institute, College of Nursing, Misamis Oriental, Western Visayas. There's a really long list here, and our panelists can see where you are coming from if you do in the chat box. So just a few ground rules on how this webinar goes. In the webinar series conducted by DOH and WHO, we give a primary attention to interactivity. So we welcome your questions and answers, but please use the Q&A function. There is a Q&A button at the bottom sa baba po ng inyong Zoom control panel. If you click that Q&A button, you can actually type in your question anytime without disturbing the speaker. So we would encourage you to please put your questions into the Q&A button. How about those of you who are watching on YouTube? Do not worry, you can also use the chat box, the live chat of YouTube. And as moderator, ako po, Dr. Albert Domingo from WHO Philippines, I will be able to pick up your question and throw it to the speakers later when we go to the Q&A forum. So there is a format that we follow, very basic. We allow 30 minutes, the first half of the webinar series, for the discussions, for the lectures, so to speak. We have a few presentations lined up. We have 1, 2, and 3. Don't worry, we will be introducing the speakers in a bit. But after the presentations are done, we will go straight to the question and answer, to be started with a few opening remarks from a panelist we have from the WHO Regional Office in the Western Pacific. That's Dr. Hiro, who will be introduced later. And after Dr. Hiro gives his opening comments or remarks as a panelist, then we will open the floor for discussion for everyone. All right? So now, for our first discussion, for our first presentation, I would like to call on Dr. Ivy Nolasco from the WHO Country Office in the Philippines, one of our colleagues, to deliver a presentation on, oh my goodness, this is a very good question. Do we really need to go out? Wow. As we know, the guidelines have changed officially in the Philippines. Those who are, tama ba, Director Faith, above 65? Above 65, below, 15 to 65. So if you're 15 years old to 65, you are allowed to go out. But let's
Yes.
hear from Dr. Ivy on what the recommendations and the guidance are to answer the question, do we really need to go out? Over to you, Dr. Ivy, for the first presentation.
Thank you, Doc Albert. Let me share my screen. Can you see my screen?
Yes, go ahead.
Okay. So magandang umaga po sa ating lahat, lahat ng mga participants itong Healthy Seniors webinar series. We hope that you stay with us until October 22 from 11 to 12 in the morning. So without further ado, let's start. So ang ating pong pangunahing paksa sa series na ito ay naglalayo na maintindihan kung bakit natin mas lalong tututukan ang kalusugan ng ating mga nakakatanda. Pangalawa ay kung paano natin maiwasan na sila'y mahawa ng sakit na COVID-19, lalo sa loob ng bahay, sa loob ng ating mga tahanan. Okay, so why do we need to focus on older adults? So based on previous experiences in other respiratory illnesses and epidemics, there is a risk of becoming severely ill for those who are 60 years old and above. Even more so if they have underlying health conditions such as non-communicable diseases like hypertension and diabetes and other NCDs. Okay, so when we have more severe cases, then there will be more hospitalizations. And if we put more strain in our health system and in our hospitals, then this can be unfortunately result to more deaths. So this is a trend not only in the Philippines, but also worldwide. Now this is a classic example of data from the Department of Health and data from the Philippines. This is this is a graph that shows the number of people that is getting infected with COVID. As we go down, this is the 0 to 4 years old, and these are the 80 years old and above. And these are the distribution or the number of patients that have COVID-19. And as you can see, there are more patients, or there are more people in their 20s until their 50s that gets infected with COVID. However, when you take a look at the number of deaths, you see more people in their 50s, 60s, and above that is showing more severe illnesses and eventually death. So how does this infection occur at home? When in fact, we do have a lot of exposure in fact, we are quite safe in our homes. So how does this occur? A lot of these infections occur because there are people in our homes that go out, no, not the older people, but those household members who are working, who mingle with other people, no. So kaya nga a lot of we encourage people not to meet commonly or meet usually with their friends, go out and drink. And because these are the main reasons nowadays where we contract COVID, we bring them in their workplaces and then we bring them into their homes. At the same time, there can be visitors in our homes that do not follow minimum public standards. We may forget to wear our masks, etc. So this can be the reasons why the infection occurs or is brought into the home. Now, when can a person be infected, or how can a person be infected with SARS-CoV-2 or COVID? The main reason for infection is respiratory droplets. So what are respiratory droplets? These are saliva or respiratory secretions that are expelled when a person coughs, sneezes, talks, or sings. So meaning hindi lang sa mga may symptoms, kundi kahit na walang symptoms, kung nagsasalita or kumakanta, meron pa rin mga respiratory droplets. Apart from that, there can be what we call as aerosols. So ano yung aerosols? These are microscopic droplets. These are very small, minute droplets that remain infectious or travel for over long distances in time. So paano ito? Lalo na ito sa mga lugar kung saan kulob o hindi open, walang klarong ventilation, and these microscopic droplets can travel further in over long distances. And these aerosols or respiratory droplets can settle in surfaces, and we call them fomites, and these surfaces becomes contaminated. So this can be tables, the common things that we touch, the things that are around the household. So this can be the sources of infection. Now, when is a person mostly can infect other people? So the best way to understand this is to understand the course of the disease.
Dr. Ivy? Okay, it seems we have connection problems, Dr. Ivy. Yeah. All right. Dr. Ivy is having connection problems. While waiting for her to reconnect, we'll give her a few minutes. I'd just like to prime Dr. Shelly De La Vega. We may have to proceed to you, although I understand your slides are also with Dr. Ivy. Maybe we'll wait for a bit. Mahirap po ang connection natin ngayon. Medyo umuulan-ulan sa labas, and the internet is a bit variable throughout even Metro Manila. Maybe I will have to call Dean Aguila because of the situation. May I please divert first to you, all right? So a little bit of a change in the schedule. Sorry Dean, na-surprise si Dean. No? Medyo dapat kasi third speaker pa si Dean. Pero ito po, isang napakagandang topic bago natin ipasa kay Dean. Yeah, so I'm seeing in the chat nagkakaroon ng technical problems. Mukhang everywhere may internet problems tayo. No? But that will not stop us from coming together and listening to this topic, which I'd like to call out Dean Maria Eliza Ruiz Aguila of the College of Allied Medical Professions of the University of the Philippines. At ito pong topic niya ay senior fitness at home. Bigla tayong magiging active. Alright. So kung eto na po pala, Dean, yan, sorry. Ngayon, alam niyo na kung ano yung pag-uusapan ni Dean Aguila, so mag-aantay na tayo. Huwag tayong aalis kasi babalik tayo kay Doc Ivy. We're going to go back to Doc Ivy, who will now resume her presentation. So wait for Dean Aguila's presentation in a bit on senior fitness after Dr. Sherry. Doc Ivy, please resume presenting po.
Sorry for that technical glitch.
No problem.
Let me share my screen again.
Yes, no problem.
Okay, so it is best for us to understand how the infection goes, no? The course of the infection. First, we need to understand the incubation period. So, anong incubation period? Ito yung time when a person is exposed to the infection or SARS-CoV-2 infection, and then until the onset of symptoms. Usually, it is around 5 to 6 days. And then afterwards, a person may develop mild symptoms, commonly cough, fever, fatigue, muscle aches and pains, stomach discomfort, as well as diarrhea. There can be other symptoms such as loss of taste or smell, headaches or nasal congestion, yung barado ang ilong, conjunctivitis or yung sore eyes, sore throat, etc. This mild phase can last until 14 to 15 days. Now, the person is most infectious around 2 days before and 10 days after the onset of symptoms. No, a person can start symptoms at 5 days, but symptoms can also appear even 14 days after the exposure. Now, if the disease progresses, a person can develop acute respiratory distress syndrome. So ano to? Ang tao ay nade-develop ng difficulty in breathing or nahihirapan sa paghinga, rapid breathing, low oxygen levels in the blood. Now, this course of the infection is also associated with what we call as viral load. So ano tong viral load? Ito yung dami ng virus sa ating katawan. Okay, so when we see a typical disease before the onset of symptoms around 2 days, the viral load in the body begins to go up and goes down 10 days after. Now, in severe symptoms and even fatal symptoms, the viral load continues to be high. Now, this is associated with what we call as viral shedding. So, ano po yung viral shedding? Yung viral shedding po yung paglabas ng virus sa ating katawan. Okay, so the more that we shed the virus, the more infectious we are to others. No? So that is why infection commonly occurs in persons passing the virus to another person when a person is symptomatic or meron siyang symptoms. But this does not mean that you cannot infect other people when we don't have symptoms, no? Because even if we don't have symptoms, we also expel respiratory droplets, and this can be a cause of infection. So hindi tayo dapat magkumpiyansa. Even if asymptomatic, we can still infect others. Now, how can we tell if we are at increased risk for getting infection? Now, there are certain places or situations wherein COVID-19 spreads easily. So this is what we call as the 3 C's. Now, what is the first C? So the first C is crowded places with many people nearby. Pwede nating i-assess ito pag tayo ay lumalabas, no, in other areas, even in our households. No? Paano natin makukuha yung COVID kung maraming tao at magkadikit-dikit ang tao? So ano yung example ng crowded places? When we go to malls, when we go to supermarkets, when we go to like the palengke, wherein there are a lot of people and there is crowding of people. But this can also happen in the home if we organize our gatherings and we don't maintain our physical distancing. So the home can also be a crowded place. Yung close contact settings, kung sa labas tayo ay kumakain, pumupunta sa restaurant, and we have close range conversation, this also happens in the home, especially during meal times. Okay, so during meal times we don't maintain our physical distance and we talk, we don't have our masks on. Okay, so tapos meron pang nagsisigarilyo at bumubuga ng sigarilyo. So these are close contact settings which increases our risk. The third C is confined and enclosed spaces. So yung walang proper ventilation, nakasarado ang isang room. Outside, it can mean malls, it can be places of worship, it can be areas where the room is closed and without proper ventilation, which is also true in our homes. In our rooms, different parts of our houses are closed and we don't open our doors and windows. Now, if these situations or if these certain places or situations overlap, the more there is an increased risk of spreading COVID-19. Now, how do we protect ourselves? So what are the protective measures and other responsibilities that we need to do? So tatlo lang ang main things that we need to remember. So first, yung hand washing at saka respiratory etiquette. So ano yung hand washing? So yung hand washing, syempre paghuhugas ng kamay with soap and water, but we can also use as well alcohol-based hand rub. So kung sa ating mga nakakatanda, kung meron silang sarili nilang room, yung ating mga nag-aalaga sa bahay, we need to make sure that they have access to clean water and soap, and we need to also give them access to alcohol-based hand rubs, etc. No? Aside from that, kung ano yung respiratory etiquette, when we cough or when we sneeze, we use disposable tissues or we use our flexed elbow. Aside from that, we avoid touching our eyes, nose, and mouth. Okay, so lalo na kapag when we sneeze or when we cough and when we touch different surfaces, and then we touch our eyes, nose, and our mouth, then there is an increased risk for getting COVID-19. Okay, so ano yung gagawin natin? We should make disposable tissues available nearby sa ating mga seniors, as well as basurahan para madali nilang ma-dispose yung mga tissues na yun. Aside from that, always remind them about hand washing and using alcohol-based hand rub. When needed, when there is no possibility or kung merong chances that there is an increased chance na walang physical distancing. Kung ang bahay ay medyo masikip at hindi possible ang physical distancing, mas mabuting we wear masks. So they wear masks as well as us. It is better for high-risk people to wear medical grade masks. Second, when we say physical distancing, it does not only mean staying at least 1 meter apart from others. The reason why we advise our seniors to stay at home is that to avoid getting close contact with other people that may cause infection. So that is why you often advise that we avoid unnecessary public activities or going out unless it is really necessary. Instead, we need to socialize through phone or online with friends and family because physical distancing does not mean social distancing. Aside from that, so we can make use of online resources. If we cannot shop online, for example, if it's not possible, then we ask the help of our family, our neighbors, and our friends to do our grocery shopping. It is important that when we have more members in the household, to assign at least one member of the family to do the shopping. Mas maganda kung during the shopping, yung destination niya from house to the market and back. So hindi papunta-punta sa ibang lugar. Aside from that, mas magandang if we have the resources and if it's possible, then we at least have 1 to 2 weeks supply of food, medicines, and as well as essential supplies. So mas maganda po yung nakastock tayo ng ating maintenance medicines, for example, for hypertension and diabetes ng at least mga 1 to 3 months. Minsan ngayon inaalaw na yung 3 months na maintenance medications para mas maiwasan yung unnecessary na paglabas. The third one is we need to put in place a system wherein we are reminded that we need to clean and disinfect frequently touched surfaces. So ano yung mga tinatawag natin na frequently touched surfaces? Yung, for example, yung mga doorknobs, yung mga cellphones na hinahawakan, yung surfaces ng tables and chairs, yung light switches, okay? Yung mga gamit sa restroom or sa CR. So these are frequently touched surfaces. So ano ba yung difference ng cleaning as well as disinfection? So when we say cleaning, it's the usual cleaning with soap and water. Tinatanggal natin yung dumi physically, and then we disinfect using hypochlorite. So I will show you later on how to prepare. It is always important to start with cleaning first before disinfection, because disinfection will not work if we do not perform cleaning first. So ito yung how to dilute or use the bleach. Okay, so before we prepare the dilution of the bleach, we need to wear protective equipment like a face shield or a goggle, long sleeve or covering the legs, gloves, apron, as well as closed shoes. Our commercial bleaches are usually like 5% to 6% bleach. Now, before preparing the bleach for 1% bleach, we need to first prepare the 0.5% bleach. So ano yung 0.5% bleach? These are usually for sa CR, yung mga may spilled body fluids. No? Okay, so mas maganda to sa ating mga restrooms. 1 part, 5% bleach, yung ating mga commercial bleaches, plus 9 parts water. That will result to a 0.5% bleach. Now, from that 0.5% bleach, we can prepare a 0.1% bleach solution by mixing 1 part of that bleach to 4 parts of water. So this is the solution that we can use in disinfecting other surfaces, such as tabletops, as well as mga doorknobs, etc. Now, we do not store this bleach in direct sunlight, and we do not use this bleach solution after 24 hours because they disintegrate, so they are no longer effective. We do not use it for spraying, okay, because it's harmful to the respiratory system. Instead, we apply it with cloth or paper towel. It is always important to prepare the solution properly in a well-ventilated area and place it in a clean and container. Now, other things to remember in the household. Now, when we are taking care of our seniors and we are the head of the household, it is important for us to set rules as well as reminders to be able for us to always put in place as well as remember ano yung mga basic measures na discuss natin kanina. But aside from that, to also mitigate or control yung 3 C's. Number 1, ensure yung good ventilation. So mas magandang every now and then we open our doors and windows. So mas magandang we open the door as well as the window to ensure that air flows into our rooms. We always ask ourselves, necessary ba yung gathering? Necessary ba yung gumawa ng event sa ating pamamahay? Kailangan ko bang umattend? So, kailangan ba siya? Kasi we, as much as possible, we discourage gatherings and we avoid the gatherings. Kung meron mang visitors, if someone plans to visit, we need to put in place precautionary measures. Kung pwede lang, i-discourage muna yung visitors for the time being. But if not avoided, then always make sure that the minimum standards are put in place. Nagmamask, wearing of the hand washing, proper distancing, etc. And when we do accept visitors, mas maganda kung nasa open space or an area with good ventilation. Kung posible, and if we do have resources, it is always important that we designate a space for quarantine. Example, kung merong nagtatrabaho sa labas, especially in high-risk areas like hospitals, or if you are a frontliner, always dealing with the public on a day-to-day basis, your work is considered as high risk. So which means that it is always important to be cautious and have a separate space for quarantining so that we can avoid the infection of our seniors. Always encourage a healthy lifestyle. So paano to? Di ba usually yung healthy lifestyle, 4 yan sila. So always advocate for physical activity, at least 30 minutes of exercise a day. Water, enough water and enough healthy and balanced meals. Avoiding smoking and drinking alcohol, but at the same time as well, take care of mental health, which will be discussed on the 3rd day. Concrete way to do that is sometimes to take a break from all the coverage of COVID-19 so that we relieve the anxiety as well as the despair of other people, of our senior citizens. Also a reminder to do not disregard oral health, to take care of oral health as well. Okay, as a take-home message for this first session, we always ensure that our health and well-being of our older people should be taken care of, especially during this time of the pandemic. For more information and for more materials, you can access our website, and the link is in the screen, on practical tips for the care of older people and people living in long-term care facilities. And we also have an annex to that, which is the toolkit for self-care. So you can access this, and we will, I think, be distributing this as well via email. Thank you.
Thank you so much, Doc Ivy, for that presentation. So we have, again, the Zoom room is full, 500 participants inside the Zoom room. And on YouTube, meron tayong, let's see how many there are. There are 376. So there's a total of 876 participants together watching all over the Philippines and also internationally. All right. Now, there are a few questions already, but the common housekeeping questions: do we give out certificates? We do not give out certificates, but we hope that the information is most useful. We do have links that we will distribute later where you can get online certificates from WHO training courses through the WHO website. Second most commonly asked question: can we have a copy of the presentations? The answer po is yes. We will distribute all presentations later after the end of the webinar. So usually in the afternoon, or we can also flash a link to the folder which will contain all of the presentations. So we move on to the second speaker. I would now like to call on Dr. Shelly Ann de la Vega, the Director of the University of the Philippines National Institutes of Health, the Institute of Aging. She is also the founding president and a lifetime fellow of the Philippine College of Geriatric Medicine. Dr. Shelly will be discussing how we can reduce the unnecessary risk of exposure by staying home and also keeping our senior citizens healthy. Over to you, Dr. Shelley, and the slides will be shared by Dr. Ivy.
Good morning, Dr. Albert, and thank you to WHO Philippines and DOH for organizing this and for inviting the Institute on Aging to be a co-organizer, and for Dr. Ivy for helping me with my slides. So the title of this section is Healthy Aging at Home, Winning the COVID Challenge. So how do we help our seniors win the COVID challenge? Next slide, please. So in this brief talk, we will define healthy aging, what are the COVID-19 challenges to healthy aging, and discuss strategies on how we can achieve healthy aging despite the pandemic. Next slide. But first, we have to know what is healthy aging. Well, we know that in this webinar, we are not all older persons. A lot of you are caring for senior citizens in your families, and a lot of you are also healthcare workers. But we know somehow how it feels to grow old, right? Because occasionally we have some stiffness in our joints, and sometimes maybe we forget some words or what to say. So sometimes we do feel old. But what is healthy aging? So healthy aging is defined as the process of developing and maintaining the functional ability that enables well-being in older age. So older people want to function in ways that are meaningful to them and do activities that are meaningful to them. And functional ability in this light is the interaction between intrinsic capacity, which is usually our own health, no? And environmental factors. So these two should work together to be able to achieve healthy aging. Now, healthy aging is achieved through a life course perspective. We also want to make sure that our pregnant women are healthy, and infants are also healthy, so that they become healthy adults and healthy senior citizens. So do you know also that WHO has declared 2020 to 2030 as the decade of healthy aging? So welcome to the decade of healthy aging. Next slide. So in the Institute on Aging, in our next slide, we studied senior citizens or older persons aged 60 and above who live in communities. This was a study funded by DOH and managed through PCHRD. And of the 355 that were diagnosed in this study by our own geriatricians in that research, we found out that there are obstacles, no? Or non-communicable diseases that are associated with an increase in COVID complications and death. Hypertension topped the list, followed by diabetes and obesity. This is before the pandemic, but these are the risks that our current study shows. Next slide. Also, of the 405 that we interviewed using the comprehensive geriatric assessment, we found out that 8.1% had pneumonia and 7.5% had asthma in their history. And in with regards to lifestyle questions, 11.6% said that they were still smoking, most of whom were men. Next. These are some of the other risks that we found out, no, related to the respiratory tract that can aggravate pneumonia. We found that only 45.9% had any vaccination, and only 35.6% had pneumonia vaccination, and only 21.2% had a flu vaccine. So very few were immunized. Next. We also looked at mental health risks, no, in this same cohort. And we realized that mental health problems were prevalent before COVID. And there are much more cases since the start of the pandemic. As a geriatrician, I have received many consults about insomnia, disrupted sleep, sleeping all day, anxiety, fear of death, and depression. And of course, there are persons with dementia who have worse symptoms, no, when they have COVID, because sometimes they can't follow the hand washing rule. They don't remember what medicines to take. And sometimes they insist on going out, no? Even if they are not, well, it's not safe for them to go out. So dementia can aggravate the course of COVID. Next. So healthy body, how can senior citizens win the fight against COVID? How do family members and carers help our senior citizens? Now, these are our healthy aging tips. No? Seniors need to prevent the onset of disease. This is what we call primary prevention. It's never too late to embark on a healthy journey. Stay active, eat healthy food, stop smoking, limit alcohol intake. Of course, we hope to find an effective cure and vaccine for COVID, but Until that time, please get yourselves immunized against influenza and pneumonia. Next slide, please. So these are our healthy aging tips, what we call secondary prevention. If you already have hypertension, diabetes, and other non-communicable diseases, you may reduce your risk of COVID complications by taking your maintenance medicines. Don't skip them. Make sure that your prescriptions are updated. You can now ask for online or even text prescriptions. So do not let the absence of a consultation face-to-face be an obstacle to your not being able to get your medicines. If you are obese, manage your weight. For example, don't take too much sugary drinks or reduce sugar intake altogether. Consult and build a good doctor-patient relationship with your primary physician. Your doctor needs to know how you are. We are eager to know how our patients are. And we are available in our clinics. Some clinics are open now, no? And are safely, they have very good safety protocols against COVID. But we also do teleconsultation. So we do Zoom consultation or Viber, whatever, through online methods. And we can also do home visits, especially for those who are unable to ambulate, who have had a stroke, broke their hip, or have severe dementia, or are bedridden for many other reasons. So we do home care or home visits. Next slide. Geriatricians in particular do what we call the comprehensive geriatric assessment. If you have the chance, please get a comprehensive geriatric assessment, because we do the following. We go beyond the regular checkup. We do a medication review, functional review, functional status. We look at we test you for depression, we test your memory, we test your gait and balance. We make sure that your vision and hearing are intact. And because, COVID you can possibly have complications from COVID, we discuss your advancce directives, with you and your family. What will you choose if you, for example, have severe COVID and are in need of a ventilator or resuscitation or ICU? Do you still want these things at the end of life? So these are very important things that we discuss with our patients. Next slide. Healthy nutrition is also very important. As much as possible, prepare your own food. I know that many of you order food from outside. That's not bad if you cannot cook. But if you can, please cook your own food. And when you do, follow the rule of variety. Have a lot of colors, as they say. Fruits, vegetables that are local and affordable. Of course, we love eating malunggay, pechay, kangkong, ampalaya, and fruits like papaya, etc. And moderation, of course. Don't eat too much. Proportionality. Make sure you have a balanced diet. Make sure that you also drink a lot of water. But of course, if you have problems with your heart or your kidneys, you have to clear how much water you can take. Ask your doctor. And engage in physical activity. Next, please. So how can seniors stay fit? These are the 4 types of exercise that we recommend for seniors. You need to have resistance training, build muscle by strength training. You can lift a few weights, not too heavy, don't have to be lifting heavy barbells. Aerobic exercises such as walking, balance, and flexibility. Our next speaker, Dean Aguila of UP Camp, will talk about the proper ways to stay fit in the next talk. Next slide. So for those who are homebound, those who cannot go out because of the lockdown and the restrictions, what you can do as senior citizens is walk in place, or dance, or do exercises, follow an online fitness video, dance with your partner, your husband, your apo. And for example, my mother, she loves to cook. She loves to go to her garden. Fortunately, we have a garden, and she plants her vegetables, and she really enjoys that. That keeps her active. She's able to get some sunlight because of that. Now, remember that housework, no, is a legitimate way of staying active. So sweep the floor, do the laundry. Those are very legitimate ways of staying active. Now, of course, for the very frail, older persons, you may have to be assisted. So our caregivers need to assist those who cannot walk, no, accompany them when they walk around the house or go outside in the garden or when they have to go up and down the stairs. Make sure that you know the limits of the senior citizen that you are taking care of. Now, let's go to our next slide. Very important. Remember that we identified a lot of mental health issues in our cohort, in our Fit for Frail research. So how do we keep a healthy mind and spirit? Next slide. Well, pray, give thanks, celebrate, and contribute. Make peace with God. Be thankful always at the end of the day. Express your gratitude for the things that you have achieved, for example, and be thankful for what you do not have. And be thankful, for example, that you did not get COVID today. No? And express your gratitude to God and to other people who help and support you. Find the beauty in yourself and others. Be appreciative and tell them, I appreciate you. You're a beautiful person inside and out. Celebrate your culture. No, we are Filipinos, and unfortunately, our senior citizens who love to dance the pandango cannot do that now, but there are various ways of celebrating our culture. And of course, continue to contribute to family and community. Give yourself to others. And don't just focus on your own problems and your own needs. If, for example, symptoms of depression and anxiety persist or get worse, make sure that you consult a clinical psychologist or a physician who can handle such a problem. Geriatricians, psychiatrists, neurologists, we can handle cases of depression and dementia among older persons. Next slide. But how do you keep an active mind? An active mind is very important. Watching TV is not bad. I know that many of you are just spending the whole day in front of the television. Not bad, but learn new things such as using the internet. Go on social media. Read. Play a musical instrument. The guitar, ukulele in this photo, the piano. Learn to sing or learn to sing a new song. Next. Now, remember at the start of this talk, I talked about having a supportive environment in order to achieve healthy aging. Now, how do we achieve a healthy and supportive environment? Next slide, please. Now, an age-friendly or supportive environment consists of social support, having good social support, because you don't want to be socially isolated. Those seniors who are socially isolated, who live alone, who don't talk to anyone, are at a higher risk of death and dementia. So we also need to have a good protection against discrimination and ageism. We need protection against violence and abuse. We need to provide continuing education and literacy programs for senior citizens. Accessibility, ramps, for example. Even use of a hearing aid is an accessibility issue. We need spaces to walk. Fortunately, many barangays now have small parks and safer roads. Even if we are now on lockdown, you can still walk in front of your house, and be active there and enable regulations for all of these. Older persons are encouraged to volunteer, to mentor, engage in activities that you can do with family members or friends, whether face-to-face or online, through your church or barangay. LGUs, mayors, barangays have and can support seniors who are homebound by checking in on them on a daily basis. I know that some barangay health workers visit homes of senior citizens and knock on their doors. You can also text them or Viber them if they have Viber, or call them on the phone. Many help by delivering food and medicines to these senior citizens. Our own barangay and volunteer homeowners had a vaccination program at the early part of COVID, and they deliver food, healthy food, and even PPEs to our older senior citizens. So that's the end of my talk, no, on how to achieve healthy aging, fight against COVID, our tips for senior citizens, and my last slide is just an invitation. Last slide, please. Just an invitation for you to join in our vision of the Filipino elderly, enjoying a healthy body, mind, and spirit, being treated with dignity and valued as a productive member of society in a dynamic process unique to him or herself, and beginning a life of unlimited possibilities. Thank you for listening, and thank you again to WHO Philippines, to DOH for organizing this webinar.
Thank you, Dr. Shelley. That was a very good presentation, and there are a lot of questions. Pahingi po ng copy. Can you please get a copy of the presentation? Wag po kayong
Yes, of course.
we will give you the presentations later at the end of the webinar. And also, this is being live streamed on YouTube. The YouTube link will remain active even after we're done with the session. So you can also share the link with your friends and relatives. And speaking of learning something new, Dr. Shelley, there are 930 online. It's a mix of both our beloved senior citizens and also our adults caring for senior citizens. Kasama na po ako doon. In fact, I had to remind my 74 thank you, Doc. I had to remind my 74-year-old mother to medyo pay attention to the next presenter because I'm now going to call on Dean Maria Eliza Ruiz Aguila of the UP College of Allied Medical Professions, ang ating pinaka-aantay. So paano ba tayo gagalaw-galaw? How are we going to move about? How are we going to stay fit as senior citizens even while we are staying safe at home? Over to you, Dean Aguila.
Good day, everyone. Thank you, Dr. Domingo. This segment will be building on and emphasizing some of the points already raised in the previous two segments. And we will be talking about how important and doable it is to remain physically and emotionally fit during this pandemic for older adults. Older adults like Tony. Tony is 8 years old and wants to remain strong and mentally fit. He complies with health standards related to the pandemic and leaves the house only for his dialysis and essential errands. He misses walking outdoors, working at the office and being with peers, and going on long drives. If you are like Tony, or if you are caring for Tony or training others to do so, then this segment will help you understand some practical pointers on how older adults can stay fit and be supported in doing so while keeping safe at home, and feel confident in adopting practical pointers related to fitness of older adults. This conversation is relevant because inactivity is a global health concern. Studies have indicated that as high as 30% of adults worldwide are not getting enough physical activity. Older adults like Tony, even before the pandemic, have been shown to be less physical active than younger persons. The situation is even more complex with older adults who are prone to frailty and other health conditions. They have been characterized as having a more sedentary lifestyle, spending up to 9 hours in sedentary activities per day. As a cause or result of reduced activity, some older adults lose mobility and functional independence. Then we have the COVID-19 pandemic adding to the equation. Measures to keep seniors safe during the pandemic have restricted their movements, and these restrictions mean that any habit related to activity has also been disrupted. These restrictions may also mean frustration and a sense of isolation for being separated from family and peers. So this brings us back to the question for this segment: how can seniors keep physically and emotionally fit during the pandemic? I propose that seniors need to move consistently to be fit. Move consistently stands for the six pointers. To be fit, seniors must motivate themselves and decide to be fit and active, move more each day, organize their daily routine to build in exercise and physical activity, vary their exercise or physical activity, engage with their family, friends, communities despite the distance, and do all the 5 pointers consistently. So, pointer 1, motivate yourself and decide to be fit and active. A good motivator would be to know why it is important to be fit and active. Seniors need to be as active as possible because inactivity has short-term and long-term ill effects on health. Therefore, being physically active is part of what it means to be healthy, like what Dr. De La Vega mentioned. At this time of the pandemic, activity also reduces the impact of isolation. Activity improves mental health because people who are active find more meaning in life, which in turn causes them to be more active. So it's a cycle. Activity reduces anxiety, improves sleep, improves mood, and energy level. Activity also strengthens muscles, bones, and joints. Abrupt reduction in steps per day, for example, as shown in one study, after 2 weeks of isolation, just 2 weeks, reduced strength in muscles that was not recovered even after 2 weeks of rehabilitation. Stronger muscles, bones, and joints allow seniors to do daily activities such as bathing, dressing, toileting, moving about, etc., in a way that is easier, safer, with much more independence, and with higher self efficacy. Activity improves balance and therefore reduces the risk of falls. Activity also minimizes or perhaps prevents age related disturbances in the immune system. All these, taken together, reduce the risk of chronic conditions related to aging. So, hopefully, these reasons help motivate seniors to be active and fit. Pointer 2, move more each day. How much more exactly? Well, the short answer is however much more that works for you. Inactive people and those with disease limitations should start with light physical activity and gradually make it more challenging over time. The longer answer is based on the WHO recommendations for older adults to do at least 150 minutes of moderate intensity aerobic physical activity throughout the week. How do you know it's moderate? That's a frequent question we're asked. So, moderate activity makes your heart beat faster and makes you breathe harder, such that you can talk but will have difficulty singing, whether or not you can carry a tune. So either that or at least 75 minutes of vigorous intensity aerobic physical activity throughout the week. Vigorous activity makes your heart beat significantly faster and makes you breathe harder such that you would need to catch your breath after a few words, or a combination of moderate and vigorous intensity activity. These activities may be leisure activity, like Dr. De La Vega mentioned, for example, dancing or gardening or swimming, play, sports or exercise, or even just moving from one place to another, like walking or cycling, or household chores, or physical activity related to work. WHO further recommends that aerobic activity should be performed in sets of at least 10-minute durations. And for added health benefits, when ready and able, to increase the activity to up to 300 minutes per week. That's a goal. And to perform strengthening and balance activities other than the aerobic endurance activities at least 2 to 3 times a week. So you see, there is room for variation within these recommendations. After all, everyone's fitness level is different. So the key message really is to be physically active your way. Whatever works for you, whatever is right for your abilities or health conditions, life demands, your resources, that's the right way. Match your activity with these and stop before you feel pain. Stopping before you feel pain is very important because Injury would require more days for recovery for seniors, which would mean more days of being less active, and we don't want that. Once you feel your abilities increase, that you have adopted to your activity, then gradually, operative word gradually, make the activity more challenging. For seniors with other health conditions, it will be safest to ask your healthcare provider about the appropriate activity for you before increasing your activity level. Your healthcare provider will advise you on any activity to avoid based on your health history or any test that needs to be done before progressing your activity. If you find the idea of moving more intimidating, then aim for sitting less. For example, set an alarm every hour to stand up if you're sitting on the couch. If you're watching TV, perhaps you can stand up after a certain number of commercial breaks. So pointer 3, organize your daily routine to build in exercise and physical activity. Routine is particularly important during the pandemic as we are trying to find our new or better normal. Maintaining a routine helps maintain mental well being and sets up habits. Incorporating exercise and activity in the daily routine makes them convenient and therefore ensures that they become habitual. For example, you can ask yourself, would stretching feel natural to you upon waking up in the morning? Or can you incorporate physical activity with a household chore that you will do anyway or that you can volunteer to do? In Tony's case, before the pandemic, he would park some distance from his office building and would have that walk to the office as part of his physical activity for the day. These days, while Tony stays at home, he counts among his physical activities his trips to the garage to lift parcels, his cooking of at least one meal a day, and some workout while watching the news. These are good examples of combining activity and routine, especially because watching TV is a sedentary behavior. You can make watching TV more active by following featured exercise segments like Dr. De La Vega mentioned, or doing simple stretches, or maybe wall push ups, or marching or jogging in place. Or maybe you can go up or down the stairs during commercial breaks. It would help increase activity if you set up your environment such that you would have to stand from time to time, but still observing safety. For example, if you'd have to walk to and from the kitchen to get water instead of having your water right beside you, or making trips to the bin to throw trash. When you get up from the couch, you can also stand without using your arms to prop up as a strengthening exercise for your trunk and legs. Household chores also make for good physical activities, like already mentioned. Tony, for example, disinfects surfaces and sweeps, cleans the cars, and other household chores. Other examples, as mentioned earlier, are gardening, vacuuming, etc. The list is endless. You can also use family time as leisure activity as well. Pointer 4, vary your exercise or physical activity. Variety will sustain your interest and will be related to pointer 1 earlier about motivation. It will prevent boredom and reduce your risk of injury. So do activities that you find enjoyable. The WHO recommendations propose variety such that weekly exercise ideally covers endurance, balance, and strength. So include some activities for flexibility as well. This is an example of an exercise and activity schedule with varied activities. For example, you can have at least 10 minutes of endurance activity every day, ideally incorporated in a routine. Then maybe 4 days of at least 30 minutes of endurance activities, say indoor walking one day, dance another day, Tai Chi on a Friday, some active family activity on a Sunday, and then strength activities for the arms and the legs on 2 days of the week, say lifting modified weights like water bottles or canned goods, or seated push-ups or wall push-ups or just standing from sitting and back to standing. And then balancing activities on 3 days a week. For example, standing on one leg, if you can, standing on one leg with eyes closed, or walking backwards or sideways or in tandem. Then flexibility on whatever soft tissue is tight. Is it the hips, the back of the thighs, the heel core, the arms, the chest? Then some sort of very light activity day as a sort of rest. Variety can also come in by changing the activity for each component. So, for example, you can change the activity for endurance. So, you can swap these with, say, following a fitness video or using a treadmill or stationary bike if you have those, etc. Keeping a schedule provides structure, develops habit, and also follows pointer 3 earlier about incorporating activity into your daily routine. The schedule may then be adjusted according to outcomes and your preference. Pointer 5, engage with family, friends, and communities if possible. Seniors should remain connected to family and friends despite the physical distance because doing so would bring some sense of normalcy, minimize the feeling of isolation, and therefore would be good for one's mental and emotional being. Studies have shown that increasing physical activity improves these points and the cycle goes on. You see, connectedness, and activity go hand in hand. Physical activity is a good opportunity for social connection. For example, seniors may join an online fitness group, or if they already belong to a social club, then they could arrange for an online movement session within that club. Conversely, connectedness may help encourage seniors to be more active as well. Family members can provide support virtually via teleconferencing. The support may be in the form of cheering or coaching during the activity, or even just to check in on the activity and routine and how the activity was for the seniors. Family members may also join the seniors in person, like this, such that the activity becomes bonding moments between the seniors and the family members. And lastly, pointer 6, do the first 5 move pointers consistently. Consistency cements activity and exercise as a health habit. A critical element for consistency would be to have a clear motivation and a health goal. That is pointer 1 earlier. To have a fitness goal that is doable related to pointer 3 on routine, and enjoyable related to pointer 4 on variety. Monitoring your activity could also help make your exercise and physical activity consistent. Seniors can use the same schedule, like I showed you earlier, as their monitoring log. Seniors like Tony have had experience monitoring and logging, for example, their blood pressures to report to their doctors, and this experience is translatable to tracking their physical activity and exercise. For example, what they did, how much they did, and how they felt for each of the activities. They can also use a simplified version of that log, just using pen and paper without using a schedule format, or they may use higher tech options like fitness tracker devices. So those are the 6 pointers for this session on how seniors can be fit during the pandemic. To be fit, seniors must move consistently, motivate themselves, move more each day, organize the exercise within the daily routine, vary the activity, and engage with others, and to do all these consistently. You might want to watch videos on physical activity, routine, and the ways to stay connected during the pandemic found on the DOH Healthy Pilipinas Facebook page. These videos and related infographics like these are also available on the Facebook page of the UP College of Allied Medical Professions. So thank you very much for your attention. Please feel free to contact me at this email address. May we all stay fit, healthy, and well. Thanks.
Thank you, Dean Aguila. That was, again, a very active, moving presentation for all of us here. there are still 930 plus participants, a mix of seniors and those caring for them. And also our medical, I'm seeing quite a few questions from medical practitioners. Thank you for sharing your email address. They also would want to get in touch. So the time is 12:13, that's 12:13. We are already over time, but I see that there is a high level of interest, and I'm sure everyone wants to hear answers to questions. I have called 3 questions from the Q&A box, one for each speaker. But before we go to that, I'd like to call on our panelist from the WHO Regional Office for the Western Pacific, Dr. Hiromasa Okayasu, or Dr. Hiro, to give us a few remarks, maybe a reaction. But Dr. Hiro, if you could also answer this very persistent question. So Miss Maria Lilia Juan is asking, why are you asking, meaning the Philippine government, of course, but in general, why are you asking the 66 years old and above to stay at home? Dr. Hiro, you can answer that and other remarks that you may have, please.
Okay, so Alberto, thank you very much for moderating. And then I also like to thank you very much for the 3 excellent presentation. And I believe that these 3 speakers highlighted very nicely the 2 major risks coming from the COVID-19 for older people. And then one is a risk of infection from COVID-19 itself, which Dr. Ivy mentioned very well. And then in other countries like Europe and then North America, 50 to 80% of the deaths from the COVID took place in a long-term care facility amongst older people. So this is a very serious risk. And then second risk is about the public health action itself, as Dr. Sherry and then Dean Marie mentioned very well, such as less access to the healthcare, less social interaction, and then activities. That's why there is a very important reason for the self-care. For self-care, in addition to the traditional risk factors such as nutrition and exercise, it is particularly noteworthy of the risks of a social isolation coming from the lockdown or fear of infection, and then people tend not to go out and then interact with others, and then which was also detailed by Dean Marie. And as Dr. Sherry said, it is very important to pray, give, thanks, celebrate, and contribute so that they sort of stay active and make sure that there is no sort of social isolation. And also, I wanted to emphasize the potential risk of oral health, because sometimes the research shows that older people loss of functional capacity start with the loss of oral health. And then this is at risk, particularly during the social isolation, and then also coming from the lack of access to the dental care. And also I wanted to point out the importance of the use of a digital device, which will provide information and help older people to stay connected. And then Dean Mario gave an excellent example of exercise together over the internet. And as Dr. Ivy mentioned, WHO Western Pacific Regional Office produced guidance for older people and then self-care infographics. And then the link for English version is available. And then also we are preparing the translation of infographics in the major language in this country, which should be available in a couple of weeks. And in addition to respond to the COVID-19 infection, we believe this is the right time to start building the system to provide better support for older people. In this context, earlier this month, the WHO Regional Committee for the Western Pacific has adopted the Regional Action Plan on Healthy Aging in Western Pacific. That describes recommendations for countries to build a system to promote health and social participation of older people. Specifically, it advocates for lifelong and a multi-sectoral approach for healthy aging, including age-friendly environment. This may sound very philosophical, but there are many easy things that we could do right now. For instance, this webinar is a great example, such as training older people and caregivers for self-care while they're at home, and then also train older people and then caregiver about the protection during the COVID. And at the community level, many of you are working right now. And then linking social services such as administration and then NGOs and then health services is very important, so that the people with the risk of social isolation or lifestyle behavioral issues can be addressed outside of the healthcare. And then we call it the social referral or social prescription. And this initiative may be started even without any additional resource, and that can be started right now. And thank you very much again, and then Alberto, and then panelists, and then other sort of participants.
Thank you so much, Dr. Hiro, for those enlightening words and for summarizing, actually connecting all of the presentations together. So as we promised, there are 3 questions which we will ask one each from the 3 previous speakers. And before I go to those questions for the 3 speakers, I just remember there is a song in Filipino. I'll translate, Dr. Hiro, but in Tagalog it says, "Tatanda at lilipas rin ako." In English, I'm going to grow old and I will fade away. But you don't have to fade away. We don't have to fade away without being healthy and while still delaying that time. So this is the perfect opportunity. And these 3 questions are now very pertinent in this time of COVID-19. So let me ask the first question. This is for Dr. Ivy. Aurora Parong is asking, I am worried about seniors who cannot do physical distancing due to some circumstances. They do not have their own rooms, or their houses have only a room or 2 but are very small. Their houses are also in crowded places, such as in informal settler areas. What is your advice to them when it comes to physical distancing and other precautions? And what is your advice to local government units or local health units to help them, given that the virus will still be with us until next year? Dr. Ivy.
Thank you, Ma'am Aurora, for that question, and thank you, Dr. Albert. I think we need to highlight the 3 main responsibilities, no, of individuals, yung senior citizens, yung mga kasama niya sa bahay, the other household members, as well as the role of the LGU. So when physical distancing is not possible, it is advisable to wear masks. But masks should not be used as a standalone preventive measure. So aside from masks, protection increases when, together with masks, we should also wash our hands regularly. We practice respiratory etiquette, meaning we cough using covering our mouth and nose with the elbow, and then not touching our nose, our eyes, and our mouth, and at the same time practicing regular cleaning. And those people in the household with the senior citizens would avoid as much as possible to go out unless it is necessary. When other people in the household needs to go out, then be very careful and that when you go out, we always practice the minimum public health standards so that we will not bring in the infection into the household. So ito yung mga kailangan nating gawin to be able to avoid infection. Our recommendation as well, if it is not possible to have a physical distancing in the household, is that you can have barriers put in place in between, like the sleeping quarters of or the sleeping place of the senior citizens or someone who is not feeling well. Okay, so for LGUs naman, ano ang pwedeng gawin or kailangan nating gawin? Una is to facilitate that enabling environment for senior citizens as well as members of the household to practice these personal protective measures. So ensure that there is access, for example, to clean water. Ensure access, for example, to soap and regular reminders to people in the community to practice personal protective measures. Mas maganda ring i-encourage ang cleanliness in the environment, and reminding everyone when they go out to ensure that where they go, physical distancing is practiced and minimum public health standards are practiced in workplaces and in public settings. Aside from that, a concrete example of what the LGU can do is to provide facilities for quarantining nung mga nagkakasakit sa pamilya. Kasi kung hindi naman possible ang quarantining or isolation in the household, there should be a facility that is separate to ensure that people will be properly quarantined. And that is the purpose of TTMFs. Back to you, Dr. Albert. Thank you.
Thank you, Dr. Ivy. Straight to the next question. This one now for Dr. Shelly De La Vega. Dr. Shelly, Marcia Samson is asking, Miss Marcia Samson is asking, should a senior risk going out to a hospital for lab tests and to consult with doctors, for example, the cardiologist or the heart doctor, or maybe pulmonologist, lung doctor, for regular checkups? Dr. Shelly.
Hello, yes. Can you hear me?
Yes.
There's some bit of a lag there, but it really depends on how severe the symptoms are. If the symptoms are acute, if there's acute chest pain, for example, shortness of breath, then definitely you have to consult. And many clinics now are quite well prepared for to accept patients, and they have very good practices to keep you free from COVID. But this is why it's important to have a primary doctor that you can text or call or talk on Zoom, because that primary doctor can decide right there and talk to you and say, okay, now we can handle this. I can just talk to you, give you some tips now. And if it's necessary for you to go to an actual clinic, then that doctor can advise you, no, you have to really go to clinic. But again, there are teleconsults available now. You can freely schedule a teleconsult. And if you need to be visited at home, that is also available. So the answer is yes, there are conditions that are necessary that you go to the clinic or a laboratory. We've had surgeries. We've had surgeries for patients that are necessary. So these things are unavoidable.
Thank you, Dr. Shelley. So, take-home point from Dr. Shelley, it's good to have a primary care provider that you can actually ask these questions and help you decide. Next question, and the last one, and this is also maybe a good way to close. We're already at 12:25 p.m., but thank you so much for staying with us. There's still around 800 or 850 participants online. Alam po namin, we know it's your lunchtime already, but thank you. So ito na, the last question from for Dean Aguila, rather. The question is from Jo Marie Tayag. Miss Tayag is asking, how do you motivate a senior who just prefers to sit down and listen to music and sleep all day? How do you get this person, this senior, to move? Dean Aguila.
Yeah, thank you for the question, Ms. Tayag. I'm sure that question resonates with many of us. So the key is to start with the interest of the senior and to start with the level of ability of the senior. So in other words, find their currency. You gave very good examples there. For example, the senior likes music and sitting. So maybe you can start with just simple moves in sitting position, not challenging, not threatening in terms of balance. And then more importantly, know why they don't like to move. So is it something that needs to be consulted with a doctor, why they want to sleep often, or is it because they have a fear of falling? In that case, then you can provide hand support, hold the hand of the senior while you're moving, even just a simple, not necessarily choreographed movements, but the key is to just move at the level and then gradually increase from there. And then maybe you can find if they have peers that would be a sort of challenge or competition for them, then maybe you can do a video conference, call their sibling, okay, let's dance together, or let's do this 10 curl ups together, or maybe their grandchild, etc. Whatever that will keep them up or alerted, and then you can just loop that back into the activity that you want. So start from their level, start with their interests, and hopefully you can build from there.
Thank you so much, Dean Aguila. Perfect way to end the first session of 3 sessions. This is a webinar series. So to all of you who are still with us, I just like to show you the links towards the slides, and also for feedback, just a quick share, and also as a reminder on what's in store for us tomorrow. So you're seeing on screen now, this is a QR code. I'm sure a lot of you are already techie. You just need to point your camera, the cell phone camera, to this QR code, and the cell phone will recognize it. Or you can ask your son, daughter, apo, grandchild to also help you out. So this will lead you to the feedback for today's session. Don't worry, we will also email this out through email. And then the next slide, which I will show, shows a QR code for the folder. It's a Google folder that will contain all the presentations, including the guide that Dr. Hiro mentioned. It's going to be there inside this folder, the presentations. I particularly like Dean Aguila's table on monitoring activity Monday to Sunday. I'm going to use that with my own senior citizen parents. All right. So having said that, again, my name is Dr. Albert Domingo. Thank you everyone for joining us for this first session of 3. The session tomorrow, October 21, Wednesday, is about what to do when your senior citizen falls ill, especially now that a lot of issues are out there when it comes to hospitals. There's a lot of cases. So what practical things can we do? And we're going to have an infectious disease specialist with us tomorrow. Stay tuned tomorrow, 11 o'clock in the morning. And then on Friday, we will be discussing senior mental health. There were quite a few questions here about anxiety, about depression. We hear you. Let's talk. And that's going to be on Thursday, October 22. Until then, I'd like to say on behalf of all participants, all the panelists, rather than the speakers, Dr. Ivy, if you could show your video also, we'll just say goodbye to our participants. So thank you so much for staying with us. Have a great lunch and please stay safe. Goodbye.